What is FAKTR? FAKTR is a fun way to assess and treat your patient population, from the very young to the very old, from the athletic to the non-athletic. The program was developed by Greg Dorr, a chiropractor, and myself approximately 8 or 9 years ago when we were working on each other with instruments, and we decided, well, we were taught to treat in positions of relaxed state or flaccid muscles. There was no eccentric, concentric loading. There was nothing else really involved. And both of us had knee problems, so when I squatted and became weight-bearing, that's what reproduced my pain in the infrapatellar tendon. So Greg then treated me as I was loading and squatting, and that seemed to make a tremendous difference versus treating it at rest. Then he had a problem with the infrapatellar tendon, which really presented a challenge. How do you treat someone when it hurts them to jump? Well, we tried that. That didn't work. So we tried to load him and simulate jumping, and subsequent to that, we've now gone to things like a stationary bicycle or a recumbent bicycle where we can crank down the resistance and get them to fire the infrapatellar tendon and then treat them at the same time. So there are various ways to recreate the provocation of an activity and whatever may reproduce the pain or discomfort or that loss of range of motion. So that's kind of the idea. From there, we've progressed on to treating virtually any part of the body. And we've used many, many, many techniques that we've gathered over the last 8 years or even previous to that in our past training. What does FAKTR stand for? F in FAKTR stands for function. We're very interested in what functions you cannot perform, not what you can do, but what you can't do. So function is very important to us. And there are various ways to assess whether or not you can do the type of function that you need for your activity, for your job, for your sports, whatever it may be. Kinetic is the next part of the FAKTR equation, and kinetic refers to the kinetic chain. Obviously, we're going to look all over the kinetic chain, trying to find the interconnectability of various parts of your body that may be causing your pain. So it may be remote from where you're actually feeling the pain. And by the way, we don't treat just on pain alone. We treat not only sites of pain, but we also treat anywhere where there is a loss of range of motion, or where there's a tightness felt by you, the clinician, or a tightness felt by the person in front of you that you're going to evaluate and treat. From the kinetic side, we go on to the treatment aspect, and treatment can be administered many different ways. It all depends on how you personally are trained as a clinician and what your background is. This is any form of manual soft tissue treatment you would like to do. You can even use acupuncture with this. Whether you're doing manual or instrument-assisted soft tissue mobilization, FAKTR will fit right into your program. The choice is yours. Use your background and your training and pull those over into our FAKTR PM protocols and concepts, which we'll get to a little bit later. From the treatment side, we're going to go into rehabilitation. When we first started this program that we've developed called FAKTR, we were looking at why not incorporate part of your rehabilitation at the same time that you're actually performing the treatment, rather than treat and then provide rehabilitation. And shortly we're going to show you how to incorporate some of those forms of rehabilitation in your actual treatment. From that, we go into provocation. Provocation means that we're going to start treating you in positions of pain, discomfort, where there's loss of range of motion or tightness in that fascia that we talked about earlier. So we're not going to just concentrate on treating pain alone. We're going to treat all of these parameters. For an example, if you have shoulder pain during abduction, we're going to actually have you go into abduction and treat you. The key there moves on into motion. Is that pain in abduction just simply at end range of 90 degrees or whatever it may be? But if you have pain during the motion going from 0 to 120 degrees, then we're going to treat you in motion going from 0 to 120 degrees. If you have no pain with that motion, however, we then load you. We put a weight in your hand, we put a band attached to you, a TheraBand or something along those lines, and then we have you do that motion, and that produces pain under load. Then we're going to treat you in the position of provocation with or without motion and with or without load. So there are various steps to the FAKTR protocols and FAKTR concepts. We need to determine if the pain is present at rest. Is it painful with motion? Is it painful under load? That is, bending over to pick up a suitcase or your briefcase for low back or shoulder or whatever activity causes your discomfort. And then we'll go into the resistance side. Do we need to add various things to make this work? Now let me also add a caveat. FAKTR protocols and concepts should never be initiated on anyone without an absolute complete history, thorough history, a thorough physical examination. And then you make that decision as a clinician if FAKTR is appropriate for you and the person in front of you, and if it isn't, then you do not do that technique. Over the last number of years, Greg and I have both noticed, and some of our clinicians have as well, that occasionally your patients will do what we call a yo-yo, where they'll get better and then they may get worse and they'll get better again. However, if you treat someone where they don't get better, or you'll treat them and they go back to ground zero, and you do that 2 or 3 times and you're just not making progress, it's then time to reassess them, reevaluate them, do some other form of testing, because there are many, many conditions that mimic musculoskeletal disorders when are indeed not musculoskeletal disorders, but some other form of disease, some of which are not treatable by this or any other method and require other forms of care. So be very careful if you're treating someone and they don't respond in a timely fashion. Don't keep treating them without a second opinion or some other form of testing. Now, you might want to ask us what's taught in a FAKTR class. We teach a number of different body parts. It's impossible at this time to cover all the body parts, but we try to cover some of the major body parts. We cover cervical, thoracic, lumbar spine. We cover shoulder, elbow. We also go to the lower extremity and cover, sometimes we'll throw in a little of the hip, but definitely the knee, the ankle, and foot. These are the major areas that are of concern to all of us in everyday activities and functions that we perform. These are some of the larger areas. However, we can show you things like how to treat TMJ with this. We can treat virtually any body part. In addition to demonstrating the various body parts utilizing all kinds of fun equipment, we're also going to introduce you to kinesiology taping using Spider Tech. We'll also tape the various body parts that I've just discussed. We'll show you how that's done, and we tape functionally. There are different ways to tape, but that's one of the things we like to highlight is functional taping. In closing, let me just say this to you. I want you to start thinking outside the box. This may be hard for some of you to do initially when you start, but once you begin this program and you see how quick and effective your treatments are going to be, not only that, but they're very long lasting, I think you'll start to look at how you treat your patient population a lot differently. So that's part of the key. Think outside that box. I'll also tell you this, that when you start the FAKTR PM protocols, your patients are going to love it. You know why? Because it's interactive for them. They think that you really understand where their pain or their loss of function is emanating from, and they're very happy to participate in it because the results are very quick. So I hope you enjoy the class, and now we'll show you how to incorporate the 5 different components of FAKTR by body part.